Refugee Medical Assistance. This presentation is a comprehensive overview of the Refugee Medical Assistance Program, intended for stakeholders, community partners, and providers. This training is provided by the Office of Medicaid Eligibility Policy within the IT Innovation and Customer Experience Administration of the Washington State Healthcare Authority. We will cover the following topics in today's presentation. A brief overview of Refugee Medical Assistance, eligibility for RMA, countable income for RMA, how to enter immigration information in Washington Healthplanfinder, authorized representatives, RMA application assisters, and RMA additional resources. Refugee Medical Assistance. The Refugee Medical Assistance Program is for individuals who are not eligible for Apple Health programs, but who meet the income and resource standard of the RMA program. An individual may be eligible for Refugee Medical Assistance if they are able to provide documentation issued by the United States Citizenship and Immigration Services that shows eligibility. RMA eligibility. Individuals may be eligible for RMA when they meet immigration status requirements listed in the Healthcare Authority Apple Health for Refugees webpage, have countable resources below $1,000 on the date of application, have accountable income equal to or below 200% of the federal poverty level on the date of application, receive refugee cash assistance. When an individual's spouse arrives in the U.S., they may be eligible for Apple Health and other programs depending on countable income. If they are not eligible due to income requirements, the spouse remains eligible for RMA for 12 months following their entry into the U.S. An individual is not eligible for RMA if they are already eligible for an Apple Health program or a children's health care program as described in WAC 182-505-0210. A full-time student in an institution of higher education, unless the educational activity is part of a DSHS-approved individual responsibility plan, a non-refugee spouse of a refugee. RMA countable income. Individuals entering Washington may receive income from supporters, organizations, or federal programs. Income types may be counted depending on whether an individual is applying for modified adjusted gross income-based programs through Washington Healthplanfinder or Apple Health Classic Medicaid programs through Washington Connection. Some examples of MAGI-based countable income are earned income from a job, including wages, salaries, and tips, foreign earned income, unearned income such as Title II Social Security benefits or dividends. Some examples of MAGI-based non-countable income are needs-based assistance from other agencies, child support payments, income from the Uniting for Ukraine program. Income must be reported when applying for Apple Health Classic programs. Some examples of countable income include gifts, educational benefits, child support or spousal maintenance, gaming income, rental income, and supplemental security income. Entering immigration information in Washington Healthplanfinder. Most individuals create an application using Washington Healthplanfinder. Selecting No to the citizenship question will allow additional options to answer as shown on the following slides. Additional questions within the application include lawfully present status, date of entry, and immigration documents. And if answered yes to immigration documents, the document type. The most common document is a passport, I-94, or a letter from DHS approving entry into the U.S. This letter will contain an A number. If an A number is available, select document type Other. Then enter the A number and description of the document. If an A number has 8 digits, add a 0 to the beginning to make it a 9-digit number. Entering passport information is not required. However, if the only document available is a passport, the information should be entered. Information from a foreign passport should be entered into Healthplanfinder as follows. The date of entry is located on the stamp within the passport. The passport number is located on the upper right corner and is either all numbers or alphanumeric. An I-94 will have an 11-character numeric or alphanumeric number as shown here. Authorized representative. An authorized representative is an individual or organization that is authorized by an applicant or recipient to act on their behalf for Apple Health eligibility purposes. This can be designated on the application or verbally. An AREP may sign an application on the applicant's behalf, complete and submit a renewal form, receive copies of the notices and communications from the agency, act on behalf of the applicant in all eligibility matters with the agency. An AREP can share any information relevant to eligibility. However, the agency can only share information with the AREP that is necessary for the purposes of determining financial eligibility. Examples of information the agency cannot share are Social Security numbers, dates of birth, home or mailing addresses, places of employment that are outside of a request for specific employment verification, and estimated pregnancy due dates. The AREP designation may be terminated at any time by either the applicant or AREP, verbally or in writing. When the applicant or beneficiary is deceased, the AREP designation terminates, except when the AREP is the executor or administrator of the deceased estate, or legally authorized by the courts or by state law to act on behalf of the deceased or their estate. Legal guardianship and power of attorney assigned while the client is living ends after the client is deceased. RMA Application Assisters. When a refugee is granted permission to come to the U.S. and granted a legal immigration status, voluntary resettlement agencies called VOLAGs are contracted for initial resettlement. The VOLAG is responsible for meeting and picking up the refugee at the airport, establishing housing, and helping with necessities and cultural orientation within the first 90 days of the refugee being in the U.S. The VOLAG also assists refugees with submitting Apple Health applications through the Washington Healthplanfinder or Washington Connection. VOLAG staff may have access to Washington Healthplanfinder or be able to gain access as a volunteer assister. Community partners who are affiliated with a community-based organization in Washington State can complete training and gain volunteer access to the Washington Healthplanfinder website. The application process includes a registration form, Washington State Patrol background check, and Health Benefit Exchange user agreement. Contact the Volunteer Assister Program to begin the process at HCA Volunteer Assister at hca.wa.gov. To learn more about the process, visit the HCA Community-Based Training page. Medical assistance applications for refugees under the age of 65 should be submitted through Washington Healthplanfinder. HCA determines eligibility for MAGI-based Apple Health programs first. If an error occurs when submitting the application, complete a paper application and email it to hcawahapps@hca.wa.gov and include the primary applicant's name, the Washington Healthplanfinder application ID, the managed care organization plan selection, and any error code if applicable. If an applicant is not eligible for MAGI-based Apple Health or becomes ineligible during the certification period, HCA will determine eligibility for RMA. DSHS determines eligibility for medical assistance for clients over age 65 who are refugees or have other eligible immigration statuses. Applicants can apply in person, online, by mailing an application, or over the phone. Interpreter services are available. RMA resources. The following RMA resources are available: the Apple Health Citizenship and Immigration Status Guide, the Apple Health Eligibility for Individuals from Ukraine, Apple Health Eligibility for Individuals from Afghanistan, Immigration Status Requirements for Refugee Medical Assistance, the Cross-Agency Desk Aid, the HCA Stakeholder Training and Education Resources, HCA Community-Based Specialists, applications for MAGI Medicaid and qualified health plans, application for Classic Medicaid, and the Authorized Representative form shared by DSHS and Healthcare Authority. This concludes our presentation of Refugee Medical Assistance. At this time, we'd like to open the floor for your questions.